back to Body Beautiful. We are talking about liposuction with Dr. Joseph Mele. And first, let me remind you that we'll be taking your calls live with your questions. Here's the phone number, 800-440-4884. Let me get that out. And we'll also be posting the number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you certainly want a second opinion. It's always a good idea, isn't it? Let's just go to the phone lines. Rochelle from Berkeley, good morning. Do you have a question for Dr. Mele?
I do. I recently had a gastro bypass. I'm coming up on a year, and I'm concerned about the skin in the arms and in the inner thigh, and so I'm trying to figure out which better, liposuction or what other procedure would probably work best for me.
Thanks, Rochelle.
Sure, that's a good question. Liposuction works well if there's still some residual fat, but the skin is tight. And normally after large weight loss, the skin is loose, and that usually requires surgery. So like the first picture pairs that we saw where the arm was reduced, that's a brachioplasty, and that involves removing the skin and then closing the area. So there is a scar with that, but it's only really to get rid of that extra skin. And the same on the inner thigh. It can be done in the same direction, though a lot of times I like to hide that scar up high so it's in the groin, and that allows me to tighten the skin on the leg also.
So doctor, does it depend on age? We talked about that before, and then the amount of weight lost, and then a person's natural elasticity of their skin.
All the above. I'll take D.
Okay, well,
D, all the above. And the reason that age comes into play really is because of the elasticity. As we lose elasticity, we don't recoil as well. And if we're not recoiling, then something needs to be done to tighten the skin.
I don't know if Rochelle is still on the line with us. Rochelle, are you still there? Yeah, I was just hoping to see if maybe you can answer her specifically. I didn't know what her age was.
It depends on her age. It depends on how much weight she's lost. It depends on that skin that is left behind and really how it reacts. And if it will recoil, then liposuction, taking away a little bit more, can help. And I do liposuction sometimes on patients who have lost a lot of weight with good results.
Just to do spot kind of?
To do smaller areas, or areas on the back, or areas where the skin's not really redundant, but there's still a little bit of fat left there.
How many liposuctions are performed every year in the U.S.?
Hundreds of thousands. Less than 400,000 last year. It's always between 300,000 and 400,000.
Okay, and
and that's just in the U.S.
I think this is really important to just establish here why, and this is rhetorical, and I know, but I just want to reinforce this for folks. Why is it important to use a board-certified plastic surgeon?
Well, you want someone who knows what they're doing, and there's no way to really test your surgeon out and find out other than to see if they have the right qualifications. And by being board-certified, it means your surgeon has gone to the right training program, has graduated, has taken an oral exam and a written exam to show proficiency, and now it's an ongoing process. So every year there's something that we do, whether it be continuing medical education, taking additional exams, to show that we're still good. We still know what we're up on the latest stuff, and we know what we're doing.
We do those news stories, the backroom, back alley procedures.
Well, I think people sometimes get into that arena because they're looking for the lowest possible price, and the lowest possible price really isn't what you want when it comes to your body.
You also blog.
I do.
And you're currently talking about lips, and you caught my attention, and this is something people are they still injecting lips? Is this kind of a popular thing?
Yes, that's still the most common way that we make lips bigger, is using the injectables. And now that we have the hyaluronic acid fillers, it's been a huge break forwards. And when we're talking about liposuction, sometimes people bring up all the different ways to do liposuction. My analogy for some of the new techniques, since there's so many of them and none of them's really taken over, my analogy is always to compare it to collagen. Now, collagen came out about the same time.
Right.
Collagen, they don't even make it anymore because the hyaluronic acid is so much better.
The allergic reactions with
You can
collagen,
get allergic reactions to it. It was 1% to 2%. It was bovine derived, so they had to keep a herd of cows just to make collagen. It was a lot of work, and though it worked very, very well for many years because there was no alternative, it tended to be hard. And in the lips in particular, collagen injections tended to give kind of firm lips. And it's one of the few products where I've changed from one thing to another. When people's husbands and mates will come in and say, I like that new stuff because when I'm kissing, I don't feel anything in there anymore. It's soft. It feels like a lip. So it's so much better. It's just replaced it. We haven't seen the same thing with liposuction. There's laser liposuction, there's vasers, there's ultrasound, there's now radio frequency, cold therapy, all these different ways to do liposuction, even power liposuction that reciprocates by itself. But nothing's taken over because it's just not a better product yet.
So there are all those modalities out there, but you tend to just...
I think most smart plastic surgeons do dumb lipo.
Don't lipo.
We still do tumescent technique because that was the huge break.
Right.
That's what made it safer. That's what made us be able to do larger areas.
You just feel you can control it better.
Well, I think it made the procedure so safe and effective that it's hard to make it better.
Okay.
And that's what we're trying to do, is make it better.
I want to get you some phone calls, but we need to take a quick break. For more information about Dr. Mele, you can call him at 925-943-6353 or check him out on the web at drmele.com or follow his blog to find out more about lips at sanfranciscoplasticsurgeryblog.com. When we come back on Body Beautiful, we'll continue our chat about liposuction and lips and other such things, and we'll be taking your phone calls.